Hello, I'm Zubair Saeed with the Fairfax County Health Department, Community Health Specialist. And today we're going to be talking about novel coronavirus, COVID-19. Specifically, we're going to be talking about what is coronavirus, what is the current risk and for whom, what can we do to prepare, what are we doing at the national level as well as the local level, where to get regular information, and finally we'll give you some other resources and contact information. So let's get into this. The situation is changing day by day, hour by hour, and so please keep yourself informed. Just recognize that the information that I'm giving you today is the most reliable and up-to-date information as of this hour, but things are rapidly evolving, things are rapidly changing. So where can we go to get some reliable information? What you can do is go to our Fairfax County .gov/COVID-19 website. This gives you an information about coronavirus from a county level perspective. Specifically, if you go here to the top, you can click on Health Info. This is a direct link here to our Fairfax County Health Department page on COVID-19 coronavirus. You see here various information on testing and guidance on mass gatherings and other detailed information. Another place you can go to get reliable information is the Centers for Disease Control, cdc.gov/coronavirus/2019 NCOV. Here you can see information on symptoms, how to prepare your family, travel advisories, and so forth. So these two websites are excellent resources to go to. So what is coronavirus? So first thing we want to keep in mind is that coronavirus does not refer to one specific virus. It is a family of viruses, right? And in this large family of viruses, we have different types of coronaviruses. For one thing you might have heard of is SARS, Severe Acute Respiratory Syndrome from 2002. Maybe you have also heard of Middle East Respiratory Syndrome, or MERS, from the year 2012. These are examples of coronaviruses. Coronaviruses can also cause the common cold. And now we have a new coronavirus, novel coronavirus, or as you can see here labeled as SARS-CoV-2. This is the virus that causes the current disease, COVID-19. And the reason this virus is named as such is because it bears some resemblance to the SARS disease that we saw in the year 2002, but it is a separate virus causing a separate disease. Sometimes these new coronaviruses emerge from animals to cause severe disease in people, and this happens when these coronaviruses mix in animals and then spread to people. This novel coronavirus is spread through coughing, sneezing, and through close personal contact. Symptoms start appearing anywhere from 2 to 14 days after getting exposed to the virus. Now, let's discuss the emergence of COVID-19. So COVID-19 infections were first recognized in the city of Wuhan in China. This virus is likely to have come from bats. There has been an intermediate animal host that has been proposed, but not yet proven. Where do we get the name COVID-19 from? So the CO stands for corona, the VI stands for virus, and the D stands for disease. And of course, the 19 stands for the year 2019, which is the year in which this disease was first recognized. So that's where we get COVID-19. Now let's go over the symptoms of COVID-19 infection. Some common symptoms include a fever, and when we talk about fever, we're talking about a temperature over 100 degrees Fahrenheit. Other symptoms include things like a cough, dry cough, shortness of breath. Other symptoms can also include things like fatigue, muscle aches, and loss of appetite. We're still learning more about this virus and this disease, and other symptoms can occur as well, but these are some of the more common symptoms listed here. How does COVID-19 spread? So as you can see here in this image, this person is coughing or sneezing into the air, and they're spewing out all of these moisture respiratory droplets. And in these respiratory droplets are things like bacteria, germs, viruses, including coronaviruses. And this is the main way this disease is thought to be spread. Namely, that when somebody coughs and sneezes into the air like this, in these respiratory droplets are coronaviruses. They don't spread very far, only within about a distance of 6 feet, at which point gravity kicks in and drops these respiratory droplets on surfaces, maybe onto our hands and onto our face or body, and people can inhale these respiratory droplets. This is the main way in which COVID-19 is spread. How does it compare to seasonal flu in terms of how contagious COVID-19 infection is? So what we notice so far with this outbreak is that this disease is very contagious. In fact, it's more contagious and spreads even more easily than what we experience with seasonal flu. So who is at risk for COVID-19 infection? Anyone who is living in a community where COVID-19 disease is occurring is at risk of infection. This risk is even more elevated for people in communities where there are more cases. Healthcare workers caring for patients with COVID-19, close contacts of persons with COVID-19, and travelers returning from affected locations all are at elevated risk for being infected with COVID-19. How about who is at risk for severe illness of COVID-19? So you see here in the first image, an image of an older adult. So anyone over the age of 60 is at increased risk of severe illness. And when we refer to severe illness, what are we referring to? Severe illness is when somebody can develop such a severe infection that they need to go to the hospital, or possibly they will develop pneumonia. And that's what we're talking about with severe illness. So some individuals who are at increased risk for severe illness include older adults. Anyone of any age who has an underlying health condition is also at increased risk of developing severe illness. And also we have an image here of a pregnant woman. Now, at this point in time, according to the Centers for Disease Control, we don't yet have enough information to know for sure how this disease is affecting pregnant women. But what we can say in general is that when a woman becomes pregnant, her body undergoes certain changes, leaving her more prone to infection. And for this reason, it's also very important for pregnant women in general to avoid getting infected with diseases, including COVID-19. Now, one group that you don't see here on this slide is an image of younger people. So the question is, can people younger than 60 years of age, can they develop severe illness due to COVID-19? And the answer to that is absolutely yes, they can. And in fact, we are seeing cases where people who are younger than 60 are developing severe illness to the extent that they're going to the hospital and even dying. So it must be emphasized here that even though these groups of people that you see here displayed on this slide are at increased risk of severe illness, other groups of people are still also at risk. Even though that risk of severe illness might be lower, that risk is not zero. So we need to make sure that everyone takes the proper precautions. Is there a cure to cure these people of severe illness? Unfortunately, no antiviral medications are currently available to cure this illness. No vaccine is currently available to prevent this disease. Currently, of course, experts in the field are working on this, but please be aware of scams that say that if you take such and such that you will be cured of COVID-19, because there is no approved medication or vaccine for this disease yet. Right now, treatment on COVID-19 is focused on supportive cure, meaning that the patients who have COVID-19 in the hospitals, they are being treated for their symptoms. Any medication which is given to them focuses on alleviating their symptoms. But as I said, there is no cure for COVID-19 as of yet. How can COVID-19 affect me? How can it affect you? You see here in the first image, a couple enjoying their meal comfortably. So what we want to emphasize here is that about 6 out of every 7 people, or 80 to 85% of individuals who get COVID-19 will experience mild symptoms, and they will recover on their own because their immune system will fight it off without the need for hospitalization. This occurs within 1 to 2 weeks after getting sick with COVID-19. Within 1 to 2 weeks, patients who experience mild symptoms, they will typically recover with 1 to 2 weeks. As we said, symptoms start appearing after getting exposed to the virus anywhere from 2 to 14 days. It should be noted that most people experience these symptoms 5 to 6 days after getting exposed to the virus. Now then, you see here another image of a person who is not well. And what happens here is that about 1 in 7 people, or about 15% of individuals who get COVID-19 infection will develop severe illness, possibly developing pneumonia. Maybe they'll need to be hospitalized. So about 1 in 7 individuals may need hospitalization due to COVID-19. How does that compare to seasonal flu? In seasonal flu, we see about 1 in 50 people who get seasonal flu may need hospitalization. So you can see here in terms of hospitalization that COVID-19 is more severe. 1 in 20 individuals who get COVID-19 infection may need intensive care in the hospital. And between 1 in 50, which is about 2%, and 1 in 100, or 1% of individuals who get COVID-19 infection may die. How does that compare to seasonal flu? In seasonal flu, it is about 1 in 1,000 people who get seasonal flu may die. So again, what we see here is that with COVID-19, COVID-19 is about, we can say, 10 to 20 times more fatal than seasonal flu. And for this reason, this is why this outbreak in particular is a very serious concern to the public. I'm sure perhaps many of you by now have seen this type of graph, flattening the curve, if you will. We call it here goals of community mitigation. What we're trying to do is delay the outbreak of disease, reduce the number of cases that occur each day, and reduce the total number of cases in the community. So let's look at this graph over here. What can happen is if we don't take any protective measures, without any protective measures in the red, what we see here is that over time, very quickly, the number of cases drastically increases. And what we see here is a horizontal line indicating our current healthcare system capacity. So if we don't take the proper measures, we'll see such a drastic increase in the number of cases that it will quickly overwhelm our healthcare system capacity. Simply put, our current healthcare system is not equipped to handle such a drastic increase in the number of cases of COVID-19. There are a limited number of hospital beds, there are a limited number of ventilators, and other healthcare resources. But what if we do take protective measures? And we're going to talk about what those protective measures are in a moment. But if we do take the proper precautions, what we're going to see is, yes, we will still see a gradual increase in the number of cases, but not to the extent that we saw over here in the red. And these number of cases is below the line of healthcare system capacity. And these number of cases also will increase, but over a longer period of time. This will allow us to treat all the patients with COVID-19 who are in the hospital or who need that type of care. But if we don't take these protective measures, again, our healthcare system will be quickly overwhelmed. So, what should I do if I think I have COVID-19? First of all, make sure that you call your healthcare provider for an assessment. Please keep in mind that testing is done through your healthcare provider. Do not fall for scams. Do not fall for people telling you, oh, come to such and such place for testing. Testing is available here and there. No, testing is done through your healthcare provider. By calling your healthcare provider, they will evaluate you and assess you. First, you need to make that phone call. And if they feel that you need to have a test done, they will ask you to come to their clinic or their office, but they will tell you what infection control measures to take, like for instance, wearing a mask, before you come to their office. Please note that local health agencies, for instance, like the Fairfax County Health Department, are not conducting testing for COVID-19. Even if you are in touch with the healthcare provider and you are following their guidance, at any time, if you have difficulty breathing, please call 911. Tell them that you have COVID-19 or are experiencing symptoms of COVID-19. Call ahead before time. Don't pop up at the emergency room. Make sure you call 911 and tell them that you're having difficulty breathing. Then you can go to the emergency room. Again, please don't go to the emergency room unannounced. And please do not be calling emergency personnel for any little thing, but rather leave it for a true emergency. For instance, if you are having difficulty breathing, that would warrant a situation where you would want to call 911. You can see here another website we have listed here, FAQ, on the Fairfax emergency site. So if I go there really quickly, you can see here, this is the Fairfax County emergency information website. You can see here there's some frequently asked questions on COVID-19, how to get tested. You can see some good information here listed as well. Now, if you are sick with symptoms of COVID-19, stay at home at least 7 days have passed since your symptoms first appeared, and you have had no fever for at least 72 hours. That's 3 full days with no fever and no use of medicine to reduce that fever, and other symptoms have gone away or improved. Of course, always follow the guidance of your healthcare provider and follow their instructions, but in general, this is good guidance for anyone who has symptoms consistent with COVID-19. If you are sick at home and being isolated, please follow these guidelines as well as, of course, listening to your healthcare provider. What if I do not have access to healthcare? What can I do in this situation? First of all, Fairfax County has many low-cost healthcare resources for individuals who lack health insurance. If you go to this website listed here, and let me get to that, this is our low-cost healthcare resources in Northern Virginia resource list. You can see here we have the names of organizations, their address, services provided, phone number, and eligibility. And there are several pages here listed. You can contact these places if you do not have health care. One thing to keep in mind for individuals who may be worried that they have symptoms of COVID-19 but they don't have a healthcare provider, please remember that even if you fall into this situation, even individuals who do have access to health care and are calling their healthcare provider, not everyone who does that will be tested. Sometimes people who have symptoms of COVID-19, they may not be tested by their healthcare provider. Why? This may occur when a physician may not have the proper materials or protective equipment to do the testing, or maybe that physician under their clinical judgment may not feel as though your situation warrants a test. But whatever the circumstance is, even whether you have access to healthcare or you don't have access to healthcare. The bottom line is the guidance is going to be telling you that if you're not feeling well and you have these symptoms, you need to stay at home. You need to stay at home. Don't have close contact with other people. Follow the guidance on our health department website and what I just listed to you on the previous slide. Follow that guidance regardless of whether you have healthcare or not. Just know that there's no magic bullet. Even if you have COVID-19, you need to stay at home because there is no cure for this illness. Get plenty of bed rest, drink plenty of water, and just take it easy at home. Now, another thing that you can do is if you do not have access to healthcare, is you can call Coordinated Services Planning at 703-222-0880. You can tell them that you don't have health insurance or you don't have a primary care provider. They will work with you to help you with your situation. Now, let's get into how can we protect ourselves against COVID-19. There are, of course, many things that we can do to protect ourselves against COVID-19. We can do personal things as individuals to protect ourselves against COVID-19. We can do things as a community. And finally, there are some environmental things that we can do. So under individual or personal things that we can do against COVID-19, of course, we have to mention hand washing. You probably heard that a lot, but even if you've heard that a lot, I'm still going to go over it because it's very, very important. We need to cover our coughs and sneezes the right way. We need to avoid touching our eyes, our nose, and our mouth as much as possible. And I know this is a very difficult thing to do, but we need to keep reminding ourselves, each other, to do this, to avoid touching our eyes, nose, and mouth. We want to practice social distancing. We want to practice voluntary home isolation and quarantine. What is the difference between isolation and quarantine? Isolation is when someone is sick with COVID-19. They're identified as being sick with COVID-19. They need to be kept separate. They need to be separated from everyone else. That's what isolation is. What does quarantine refer to? Quarantine is for an individual who may have had contact with someone who has COVID-19, but that person themselves is not yet displaying symptoms of COVID-19. When that person is separated, even though they're not yet sick, that is called quarantine. So we want to make sure that we are isolating and undergoing voluntary home quarantine when advised to do so under the guidance of your healthcare provider and under the guidance of the Fairfax County Health Department. And finally, the last thing we have listed here under personal things or individual things that we can do to protect ourselves against COVID-19 is proper sleep, nutrition, and physical activity. Why do we mention that here? So we want to make sure that we get 7 to 8 hours of sleep per night. We want to get a balanced, nutritious diet, getting all of our essential vitamins and minerals. And we want to engage in 2.5 hours of physical activity per week. By doing these three things, we can help with our immune system. We can make sure or help our immune system function well. And because COVID-19 is a brand new disease, we don't have immunity to such a disease right now because it's brand new. So anything you can do to make sure that your immune system is functioning at a maximal level will help protect you against COVID-19. Okay, so what can we do as a community? We can practice social distancing. We can close schools, which of course is already being observed in our local area. We can modify work practices and cancel mass gatherings, which of course is also the guidance so far nationally as well as statewide and in Fairfax County. And finally, under environmental things we can do, this simply refers to environmental surface cleaning. You can use the common everyday cleaning agents that you use every day to clean your home. They will be effective in removing COVID-19 from surfaces in and around your home. Now let's talk more in depth about hand washing. Proper hand washing with soap and water is really the best way to keep your hands clean. And if we see this quick video, this will help to illustrate this point. So as you can see here, this girl is scrubbing with soap and water both sides of her hands, front and back, under her fingernails, between her fingers. Make sure you get your thumbs as well. And after you are finished washing your hands with soap and water for 20 seconds, you want to dry with a towel. You want to make sure that when you wash your hands, you're scrubbing pretty hard. It's the friction of the soap against your hands and that rubbing action for 20 seconds. That is what helps to kill germs. That's what helps to break up viral particles like this coronavirus. If you're not doing that, if you're just simply putting your hand under water, you're not really doing much to keep your hands clean. How about the temperature of the water? How important is that? It's not that important. What's really important is making sure that you spend that 20 seconds. So the temperature of the water, you want to keep it at such a temperature that is comfortable for your hands to spend that 20 seconds washing your hands. And that 20 seconds is about singing the happy birthday song twice. That's about how long 20 seconds is, to give you somewhat of an idea. And just by doing this very simple yet effective technique, we can drastically cut down the transmission of COVID-19 in our community. A really quick note about hand sanitizers. Hand sanitizers are an acceptable backup method to clean our hands. You want to use alcohol-based hand sanitizers. You want to only use those hand sanitizers because it's the alcohol which kills germs and can break up viral particles on your hand. However, please note that using a hand sanitizer is no substitute for hand washing. Hand washing with soap and water for 20 seconds properly and frequently is the best way to keep our hands clean. What else can we do to protect ourselves? As we mentioned before, we want to cover our coughs and sneezes the right way. You can see here in these images exactly that. So we want to cough and sneeze into our sleeve. And or what we can do is use a tissue, cover our cough and sneeze that way, throw away, and then once you do that, throw away the tissue in the garbage, and then wash your hands as we just discussed. Sometimes people have a concern about, well, if I'm coughing and sneezing into my sleeve, into my clothing like that, aren't those coronaviruses going to be on my clothing? So a quick note about how long viruses remain on surfaces. On soft surfaces such as clothing, these viruses don't really remain on surfaces very long. On hard surfaces, they remain longer, maybe a few hours up to a day, possibly maybe even 2 or 3 days, depending on the exact right conditions such as temperature and moisture on the surface and so forth. So in terms of soft surfaces, you don't need to worry about these viruses remaining on soft surfaces very long. When we talk about environmental cleaning, that's when we'll talk more about hard surfaces. Another thing we need to keep in mind with covering our coughs and sneezes and how we can protect ourselves, to make sure that we avoid what these individuals are doing in these pictures and these images. We can see here someone is covering their cough and sneeze using their bare hand. So when we do that, everything that is coming out, all that bacteria, those germs, viruses, they all come out onto our hands. So we want to avoid doing that because, of course, we can touch surfaces and shake hands with people, and we can quickly spread not just COVID-19, but flu and all types of other types of diseases. This individual here is touching their eyes, rubbing their eyes. So again, we want to avoid touching our eyes, our nose, and our mouth as much as possible. This will help prevent you as an individual from becoming infected with COVID-19, because in that case, even if you have it on your hands, it's not going to get into your body unless you're touching your nose, your eyes, your mouth, and so forth. So as I mentioned, another thing we can do is environmental surface cleaning. We want to use regular household cleaning agents that you always do. You want to make sure that you get surfaces that are frequently touched by our hands, like for instance this light switch or this doorknob or table surfaces. And as I mentioned, viruses, typically coronaviruses, remain on such hard surfaces for, we can say, a few hours up to a day, possibly longer if the right conditions are met. But for more information on environmental surface cleaning, you want to go to the CDC. But the main message here is not necessarily how long viruses can remain viable, able to infect people, but the bottom line here is routinely clean these surfaces in and around your home. So, other things that we can do to protect ourselves: social distancing. We mentioned earlier that these respiratory droplets that come out of our nose or our mouth when we're coughing, these respiratory droplets don't travel farther than 6 feet. Therefore, COVID-19 infection is spreading through close personal contact. So if we can keep a distance of 6 feet or more, we can help prevent the spread of COVID-19. Another way, of course, of practicing social distancing is if you're working, maybe you can work from home. As you can see here, this person has an excellent work site. They're working from their home and has an excellent view of this forest. So if you're able to work from home, that's a good way of practicing social distancing and avoiding spread of COVID-19. Another thing to keep in mind is if you're going to shop, and of course people need to get essential supplies like food, one thing to keep in mind is perhaps going to the store when it's not as busy. And that's what you see here in this image of an empty parking lot. Maybe you want to go early in the morning or late at night. Whenever you feel the store is not going to be as crowded, would be a better time to, of course, go to such a place so that you are avoiding a crowd of people. And again, if you want to modify work practices, so you can either work from home, but you can also conduct meetings with your workplace as well. But just don't do it in person. You can do it virtually. You can do it online through phones or other types of teleconferencing. Anything that you can do to modify business and workplace practices so that people are not within 6 feet of each other is a good idea. Okay, what about canceling mass gatherings and temporary closures? So you have probably heard about this guidance already. The CDC came out with guidance to avoid mass gatherings of more than 50 people. And you probably also heard of the ban in Virginia of crowds more than 100 people. Now, since those guidelines came out, they have been amended because you heard of federal guidelines coming from the White House telling the public to avoid gatherings now of more than 10 people. And those guidelines are now being followed by the state of Virginia as well as Fairfax County. So we do encourage people absolutely to avoid gatherings of more than 10 people. If you have more information on that or more questions on this type of information, again, go to our Fairfax County Health Department website to get the latest guidance on mass gatherings. But as I said, as of right now, in the state of Virginia and in Fairfax County, we are encouraging people to avoid gatherings and to suspend gatherings of more than 10 people out in public. Okay, what is the deal with face masks? Should I wear a face mask? Should I not wear a face mask? The question is, depends on who you are. So here we see a surgical or medical mask, as we call it. And this type of mask is good to wear for people who are currently experiencing symptoms of COVID-19. So if you are sick with COVID-19 and you are coughing, for instance, this would be a good surgical mask to wear, for instance, if you need to go to your healthcare provider. So in this case, that's what we advise. And we only advise wearing this type of mask if you are sick. How about if you are healthy? You're not showing any symptoms of COVID-19, you're healthy, you want to go to the store, you want to go out in public, should you wear this surgical mask? As of right now, the Centers for Disease Control, the CDC, does not advise the general public who are healthy to wear such a surgical mask. And the reason is twofold. For one thing, these surgical masks don't they're not very, very effective at preventing a healthy person from getting COVID-19. They might provide you with a little bit of protection, but not enough that the CDC warrants healthy people to wear such a surgical mask. And again, the other reason this type of surgical mask is not advised for healthy people is because we want to reserve these masks for healthcare workers who are on the front lines treating patients with COVID-19 in clinics and in hospitals. So if everyone buys up these masks, we're not going to have enough for the people who are on the front lines treating patients with COVID-19. And as I said, it's not all that effective in preventing you as a healthy person from getting COVID-19. Another type of mask that you may have heard of by now is something called an N95 respirator, as you see here in this image. Now, this type of respirator mask provides a tight seal fit around your nose and around your mouth and blocks out many particles in the air and will do a very good job of preventing someone from getting COVID-19. Is this type of respirator advised to wear for the general public who are healthy to avoid getting COVID-19? Again, the answer is no. And the reason for that is, as I said earlier just now, these types of respirators, we need them for healthcare workers who are treating patients with COVID-19. And we only have a limited supply of such respirators. We want to keep them for the healthcare workers who are treating COVID-19 patients. Also, another thing to keep in mind is these types of respirators need to be fit tested. And by that I mean they need to be tested. You go through a procedure whereby you know that this particular respirator mask is fitted on your face properly enough to block out particles. If you don't go through that fit testing procedure, guess what? You don't know for sure if it's working on you properly or not. So most people are not aware of that procedure. Typically healthcare workers are. So again, the bottom line here is the CDC does not advise that the general public use this respirator for this outbreak at this particular moment in time. Now let's take a moment to talk about what is the national response. What are we doing as a nation to respond to COVID-19? A U.S. public health emergency has been declared. A public health emergency has also been declared in the state of Virginia. Guidance to health departments and the public is being given. There is coordination of surveillance with state and local health departments. We do have a diagnostic test, and as you may have heard, there have been issues with testing capacity, and they are actively trying to do their best to expand lab testing and making testing more available to people. We ask for patience as, of course, everyone is frustrated with this situation. We at the health department are frustrated as well. And all we can do at this point is hope that lab testing gets to where it really needs to go, to the people who need to be tested. And this is being expanded as we speak and will continue to be expanded. There is vaccine development currently underway, clinical trials of antiviral drugs to treat COVID-19 patients. That development is underway as well. These things take time, so they won't be available right away. But again, stay tuned to the CDC and our Fairfax County Health Department website for more information. And there is guidance for pandemic preparedness. So this is what is going on at the national level. How about at the local level? What is Fairfax County doing to respond to this outbreak? At the Fairfax County Health Department, I can tell you that we are identifying and investigating cases and identifying contacts and preventing disease spread. We are monitoring people who are in voluntary quarantine and who are isolating or who are in isolation at home. So we are in touch with these individuals. We have, in some cases, a public health nurse assigned to them, but we are monitoring patients with COVID-19 as well as their contacts who are in quarantine. We are consulting with healthcare providers regarding persons who have illness consistent with COVID-19. We are giving guidance to physicians out there about testing for COVID-19, and as I said, we are investigating contacts. The health department is also providing information to county partners and the community which is exactly what I'm doing right now with all of you. And we are planning measures to decrease the impact of illness if it spreads in Fairfax County. And again, if you go to this website here that I showed you earlier, this is our health department website on coronavirus. So as you have probably heard by now, Fairfax County Public Schools, of course, are closed for the time being. And there are questions about where can students, kids, get their breakfast, get their lunch. Well, guess what? There's a website. If you go to this website listed here, and I'll show you that over here. If you go to this website here, you have information on where people can pick up their breakfast and lunch. It's a grab-and-go food distribution site. And if you scroll further down here, you will see the sites, the schools and places you can go to pick up food, breakfast and lunch for kids. For adults, as you can see listed here, adults may pay $2 for the meals as well. For the kids, it is free. And again, this is the website. Okay, how about travel advisories? As you probably heard, the State Department is advising all Americans at this point in time not to travel outside of the United States. If you ever have questions on travel advisories, again, you can go to the CDC website on coronavirus, and if you click on travel or travelers, you will see detailed information on traveling on the CDC website. It's best to just go there to get the updated guidance because, as you may imagine, it's always changing. Okay, how about family and workplace preparedness? So we want to make sure that we promote and enable hand washing, proper respiratory etiquette. That means covering our coughs and sneezes the right way, staying home when sick. We want to make sure that such practices we want to make sure that we make it an everyday practice, because just because something is common sense doesn't make it common practice. And we want to make sure that we drill into our minds that we practice and promote these healthy measures to avoid the spread of COVID-19. In the workplace, we want to review sick leave policies so they are supportive of good practices. The reality is some people don't have the luxury of skipping work because they're not feeling well, and then they'll come to work and then they'll spread disease. So whatever we can do in the workplace as businesses and maybe as business owners is to review these sick leave policies so that we can help people and enable them to stay at home if they are sick, especially during this outbreak, so that we prevent the spread of disease. Enable social distancing. Anytime you go out of your house, even within your house, enable social distancing. Review, revise telework and flex time policies. Reduce in-person meetings. And as we already talked about, travel, and plan for teleconferences or webinars. In your workplace, plan for high staff absenteeism and possible disruption of supply chains. But what I want to emphasize here is whatever you're doing, and hopefully you are practicing all of the measures outlined here in this slide presentation, please do not panic, but rather act with prudence and preparedness. We can get through this together if we as individuals and as a community practice all of the measures that we have outlined in this presentation today. This is a serious outbreak. We do need to take it seriously, but it's not a time to panic. We can get through this with prudence and preparedness. Again, this is just another reminder that we showed you this website at the beginning of the presentation, but again, if you go to fairfaxcounty.gov/COVID-19, this will give you a lot of good resources and information on coronavirus at a county level. Other resources that are other places that you can go to, websites that you can go to get very good information on COVID-19. We mentioned the CDC website. You can go to the Virginia Department of Health. That's vdh.virginia.gov, as you see here. We mentioned, of course, our Fairfax County Health Department website. We should also mention Coordinated Services Planning. If you see this website listed here, they also have excellent information on coronavirus. And then finally, if you want to get the latest updates on what is going on with COVID-19 in Fairfax County, you can do this. Text FFX COVID to 888-777. When you do that, they will send you updates, whatever is going on with COVID-19, pertaining to COVID-19 in Fairfax County. You will get regular text updates. Whoops. So that does it for this presentation of COVID-19. Thank you very much for your attention today. Do you have questions? You can email us at hdoutreach@fairfaxcounty.gov, or you can email us at ffxcovid@fairfaxcounty.gov. Thank you, and stay safe and healthy out there.